Hey everyone, this is Rick MacDermid here with Senior Solutions Group, and we're going to talk about some late breaking news, so buckle your seatbelts. And if those of you who haven't subscribed to our channel, feel free to do so and share it with a friend. So just today, CMS, this is the 24th of February, happy birthday Dad, my dad's birthday today. CMS has announced they're redesigning the accountable care organization model, which most of you probably have no clue what that is, to provide better care for people with traditional Medicare. And I'm going to toggle back and forth between three articles here today. Just kind of in a nutshell, there's two different types of Medicare plans. If you're on original Medicare, you have the option to enroll in a Medicare supplement plan. So you would use your red, white, and blue Medicare card and use a Medicare supplement plan to pay the leftover costs that Medicare doesn't cover, such as the 20% if you go to a doctor or the ER, or if you need to be airlifted, or the deductible for Part A if you're hospitalized, which went up over $1,500 per hospital visit in 2022. And then you also have the opportunity to buy a prescription drug plan, which is a standalone drug plan. Now, the other option is, now you ever wonder why you keep seeing more and more of these Joe Namath ads, these Jimmy Walker, Dr. Phil, Captain Kirk, Medicare Advantage plans? So something that's supposedly so much better than original Medicare, why are they spending tens of millions of dollars on these ads? And I'm not bashing Medicare Advantage, but a lot of people sign up for Medicare Advantage based on watching one of these 60-second commercials where you can get all these free goodie bag items. So a lot of people don't know the full scope of Medicare Advantage. So Medicare Advantage was set up to be a money saver. This is an article I found on, it's called prospect.org. I'll put the link in it down below so you can check it out. So there's some representatives going back and forth fighting over this new method of people on original Medicare, where private equity companies, physician groups, hospital groups, insurance companies are getting contracted by the federal government for people on original Medicare. That's not Medicare Advantage. Representative Pramila Jayapal, she's actually from our state in Washington, has called it the biggest threat to Medicare you've never heard of. So most of you probably never heard of this. It's known as the direct contracting program, concocted by the Trump administration and not yet ended by the Biden administration, to fully privatize Medicare. So hidden in the weeds of Obamacare, the Affordable Care Act, was a provision to enable CMS, which is the government entity which runs Medicare, to enact pilot programs to make Medicare more efficient, more cost effective, which is all well and good. But out of that, the government has empowered CMS to come up with these pilot programs where Congress doesn't have to vote on. And in this case, there are 53 of these direct contracting programs. Of those, 6 of them are run by private insurance companies who control half the people on these direct contracting programs. So what they are is, this direct contracting is patterned off of Medicare Advantage. I'm going to read through this article. It's publicly financed, privately owned, and it's a hugely profitable version of Medicare, now enrolling 26 million people at an annual cost of $343 billion. Simply put, direct contracting is Medicare Advantage on steroids. So what these private equity companies, these huge provider organizations, these hospital groups, doctor groups, they see that 40% or 42% of people on Medicare are enrolled in the Medicare Advantage model, the one on the right. They're looking at ways to get the other 60% without having to run Joe Namath ads. So you can be enrolled in a direct contracting model without your knowledge. You might find out from your provider that, oh, by the way, we are participating in a Medicare direct contracting model, and the only way out of that is to find another doctor. So what the government's trying to do is they're trying to refine it, to fine-tune it, to make sure that these companies aren't over-profiting from this direct contracting model. Right now, Medicare Advantage companies must spend at least 85% of the money they take from the government, because these Medicare Advantage plans get funded by the government, and they found a way. One of the hallmarks of Medicare Advantage is a system called upcoding. So with upcoding, if they can find people who have, for the sake of time in a nutshell, more health issues, they can bill CMS, the Medicare Trust Fund, more money to take care of those people. And the insurance companies have gotten really good at this. They found a way to get more money from Medicare versus someone who's going to stay on regular Medicare. That's original Medicare on the left. So the Medicare Advantage per person costs more for the government, for taxpayers, you and me, than people on traditional Medicare. So again, we're not bashing Medicare Advantage. We have clients on Medicare Advantage. Again, more and more people sign up for Medicare Advantage not knowing what the entirety of the program is. They're looking at the free stuff, the free this, free that, get money back on your Social Security check. So a lot of these companies are banking on people not really reading the fine print and signing up for a plan so they can get money from Medicare and funnel your care through their provider networks, and also ration care through the use of prior authorizations. So what the fear is, Elizabeth Warren, a number of other Democratic congressmen and senators have said to CMS, is their concern is they want to end this DCE program, direct contracting program, because they see it as the Medicare Advantagization of regular Medicare. So people on Medicare Advantage make the choice to enroll in Medicare Advantage, where people on Medicare, original Medicare, have decided to use the True Blue, red, white, and blue Medicare card. So there's a lot of politics going on right now. It's complicated. Just like this article says here, the oil and gas industry, it generates enough money for large insurance companies to convert $150 million of profits into campaign contributions. By design, Medicare Advantage covers the costs of health care that are not covered at all or only partially covered by Medicare. So for example, Medicare Advantage companies can ration your care, and then they can give you extra benefits, give you a piece of the pie, but they keep the rest of the pie for profit. So dental, vision, give backs on your Social Security check, free robotic dogs if your apartment doesn't allow dogs. So there's a lot of these little goodie bag items that they're giving you a piece of the pie, where they're keeping the rest of the pie as profit. So we're going to skip the rest of this article again. I encourage you to read the full article. Unlike the Defense Department's TRICARE and Veterans Health Administration, Medicare is not a public health system. It is a public financing that relies on a joint public-private insurance arrangement. The rules are set by the Centers for Medicare and Medicaid Services, CMS, and Congress, and claims processed by insurance companies under contract to the federal government. Money from the Medicare Trust Fund, taxes, and beneficiary premiums. So Medicare Part B has a premium of $170.10 a month, which went up from $148.50 in 2021. So these premiums help pay for the Medicare Trust Fund and secure the private U.S. healthcare system. Medicare Advantage, on the other hand, changes one critical element. The intermediary between the money and the services. So Medicare still pays, but the Medicare Advantage company, a private insurance company such as Humana and United Healthcare, which control about half of the Medicare Advantage business nationwide, turns over all parts of the insurance function, including enforcing the rules for Medicare necessity and deciding how much to pay providers to private companies. And that's what the fear is of the Medicare direct contracting entities is that it's going to become another big Medicare Advantage system without people realizing what's happening. So a lot of people, again, don't know about this. So retirees can choose from 3,800 plans offered by 9 different, well, there's more than 9, but 4 in 10 Medicare beneficiaries are on Medicare Advantage. Because traditional Medicare leaves a lot of holes that retirees must otherwise fill out of their own pockets, such as dental, vision, hearing, beneficiaries are responsible for monthly premiums, deductibles, and co-insurance known as cost sharing. And unlike commercial insurance, Medicare itself has no cap on out-of-pocket spending. So if you're on a regular health insurance plan from your employee, you would have an out-of-pocket maximum. It might be $5,000, $3,000, $10,000. Typically, a Medicare Advantage plan will have a cap of between $4,000 and $10,000, depending on the plan you select per year. So 26 million people U.S. find Medicare Advantage a deal they cannot refuse. A lot of them due to Joe Namath and these big giant telemarketing companies selling nothing but Medicare Advantage. So the Medicare Advantage profit-making formula is simple. Get a large sum of money from the Fed, spend less than traditional Medicare, give some of the excess to beneficiaries, and pocket the difference. As of today, February 24th, CMS is redesigning this accountable care organization model to provide better care for people on traditional Medicare. So your voices are starting to be heard. I advise any of you who haven't contacted your representative, your congressman, or your senator to do so, to voice your concern about private companies overtaking traditional Medicare. Because right now, these private companies only have to they only have to pay 60% of the funds they get on health care, and they can pocket 40%, unlike Medicare Advantage and Obamacare health insurance, where they have to spend 85%. So building on the Biden-Harris administration's priorities for a better health care system, today, February 24th, the Center for Medicare and Medicaid Services, CMS, announced a redesigned accountable care organization model that better reflects the agency's vision of creating a health system that achieves equitable outcomes through high-quality, affordable, person-centered care. The ACO, Realizing Equity, Access, and Community Health Model, also will be known as REACH, will start January 1st of 2023, next year. So this is a redesign and a rebranding of the global and professional direct contracting model. Addresses stakeholder feedback, participant experience, and administration priorities, including CMS commitment to advancing health equity. In addition to transitioning the GPDC model to the ACO REACH model, CMS is canceling the geographic direct contracting model known as the GEO model, effective immediately. So the direct contracting model, which was announced in December of 2020, was paused March of 2021 in response to stakeholder concerns. So it goes on to say the Biden-Harris administration remains committed to promoting value-based care that improves the health care experience for people with Medicare, Medicaid, and marketplace coverage. So what they're really concerned is underserved communities getting the raw end of the deal with these Medicare providers not wanting to cover people in underserved communities. Another concern is that this ACO REACH model, this is another article which we'll post below, which you can follow as well, or click on the link and you can check out the whole article. The ACO REACH will also contain stricter policy on the amount of provider-led governance. For example, the direct contracting requires providers to make up 25% of governing or voting rights, but ACO REACH will require providers to comprise of 75%. So the providers will have more of a say rather than Wall Street insurance companies, which is good. Each model must also have separate beneficiary and consumer advocate representatives on the board, another good thing, according to senior administration officials. So they're working on it. The current model allows the representatives to be the same person. CMMI will also crack down on compliance and coding practices to ensure that there is no inappropriate coding practices, a nod to concerns from progressive lawmakers such as Elizabeth Warren, who asked the center to get rid of the direct contracting model entirely. So Elizabeth Warren called for CMMI to dropped the model during a hearing earlier this month. So over the last month or so, there's been a lot of back and forth about whether to scrap the whole thing or to revise it. So again, let your voices be heard. She charged that the model would help privatize traditional Medicare and turn the program over to corporate profiteers. So again, of the 53 contracting entities, direct contracting entities, a bunch of them are private equity firms. 6 of them are insurance companies, which control half of the people on these pilot programs. Critics have claimed that direct contracting would employ similar tactics used by Medicare Advantage plans to glean overpayments from traditional Medicare. Warren and others have claimed that some plans work with providers to add unnecessary diagnosis to inflate scores of Medicare Advantage beneficiaries, also known as upcoding, thus inflating the patient's risk scores and getting a higher payment from Medicare. Warren said that under the capitated payment model, providers would also be able to pocket any profits, creating an incentive to lower quality of care. So a group of 54 House Democrats wrote the Department of Health and Human Services Director Javier Becerra last month in January asking for an end to the model, completely ending it, citing similar concerns. It's a big tug of war going on right now, folks. Your voices need to be heard. Those of you who want to protect original Medicare, you worked hard for your red, white, and blue Medicare card, and you don't want to sign it over to a private insurance company. You want regular Medicare. You need to make your voices heard. These panels can't be comprised of insurance companies who have their best interests at heart, not your best interests at heart. So when you call your congressman, you need to say that. You need to say, look, original Medicare was intended to give us freedom of choice, not be put in a network, not restricting our care, not funneling our care to a provider network. Take the good part of this direct contracting entities to help underserved communities. In other words, take the fish, throw out the bones. Protect Medicare, protect it for those who've worked hard for it. Leave Medicare Advantage to the people who want Medicare Advantage, and leave traditional Medicare for those of us who want traditional Medicare. So those are your marching orders. Again, feel free to reach out to us, seniorsolutions.net. We are here for you. We're here to keep you updated. We have these links to these articles, and get informed and take the time to reach out to your congressman. And thanks for taking the time to check out this video, and have a tremendous rest of your day.